Hi, welcome back to Our Skin Admission, your go-to podcast for cutting through all the noise in aesthetic medicine. I'm your host, Raquel Merlini, and today we're going to dive into the world of Sculptra, a game-changing injectable that's got everyone talking, but not always for the right reasons. Sculptra. It's made of poly-L-lactic acid. It's a collagen stimulator. It's used for facial volume restoration and even body contouring. But there are some big misconceptions out there that can make patients hesitant or confused. Today, we're going to bust 6 common myths about Sculptra with some evidence-based clarifications to help you make informed decisions. Whether you're a provider, a patient, or just curious, this episode is for you. So let's get started. Myth 1, Sculptra gives instant results like other fillers. First up, the idea that Sculptra works with your typical hyaluronic acid fillers like Juvederm or Restylane, giving you instant volume, is not true. Sculptra is about playing the long game. It's made of poly-L-lactic acid, or PLL, which stimulates your body to produce its own collagen over time. You're looking at a time frame of about 2 to 6 months for those full natural looking results. A 2010 study in dermatologic surgery found that Sculptra's effects peak around 4 to 6 months and last up to 2 years. That's a gradual buildup, okay? That's what makes it so natural looking. It's perfect for patients who want subtle enhancement without that done look, right? So why does this matter? If your injector doesn't explain this timeline up front, you're going to walk away disappointed. You're expecting a quick fix. This is not the product for you. A credible injector will say that the experience is going to be a marathon, not a sprint. So again, you want to make sure that you set your expectations with your provider, that they are realistic, asking what is the timeline for your results. And if they're promising instant volume, that is a red flag. That particular day on treatment, of course, you are going to, on treatment day, you are going to see a beautiful, fuller face. However, that collagen is going to start to build, then it kind of dips, and then at week 4 to 6, it is like kind of like that turtle again. Remember, it's a marathon, not a sprint, okay? Okay, so let's talk about myth 2, that Sculptra has severe side effects, okay? Let's tackle that fear that Sculptra is risky or causes serious side effects. This is a biggie because no one wants to mess with their face or their body if they think it's unsafe. Here's the truth. Sculptra, it's FDA approved, first in 2004 for HIV-related facial lipoatrophy, and then in 2009 for cosmetic use. Again, when done by a trained professional, it's got a solid safety profile. Common side effects, like anything, we're using a needle, there's going to be trauma to the skin. So you want to think mild swelling, bruising, or tenderness at the injection site. Stuff that goes away quickly. Serious issues like nodules or granulomas are rare, happening in only 1 to 2% of cases, according to a 2015 Journal of Cosmetic Dermatology study. And they're usually tied to improper technique or dilution. The key here, again, is to find and choose an experienced injector. They'll follow protocols like proper dilution. The dilution has changed, and I really actually don't even like to use the word dilution. Reconstitution has changed over the years and altered, as well as the ways that we mixed it. Okay, so again, technology, years of injecting, what happens is then you end up seeing a better way to utilize a product. Also, the 5-5-5 massage rule. So if you've been a patient here in my office, we send a nice little cheat sheet home with our patients, and that massage rule is 5 minutes a day for 5 times a day for 5 days. So 5, 5, 5. This will help to reduce the risk of nodules and granulomas. Again, check your injector's credentials. Here in Michigan, we have the LAR database, and this will ensure that your provider is legit. Always safety first, folks. That's a big one. Okay, let's talk about myth number 3. Sculptra is only for older patients. Myth number 3, Sculptra is not just for older folks with major volume loss, okay? It's wrong, wrong, wrong. While it's great for restoring those sunken cheeks or deep folds, it's also a preventative powerhouse for younger patients in their 30s and 40s. My friend Ashley, she likes to always think you are banking. She uses the analogy, you are thinking your 401k, right? So you want to think early jowling, temple hollowing, or just wanting to bank that collagen for the future. A 2019 review in Aesthetic Surgery Journal highlighted Sculptra's versatility across age groups, calling it a go-to for both corrective and preventative treatments. So, why does this matter? Well, a skilled injector will tailor Sculptra to your specific needs, whether you're 35 and want to stay ahead of the aging game, or you're 55 and need volume restoration. During your consult, you want to ask, how can Sculptra fit my goals? A good provider, ladies and gentlemen, will assess your facial anatomy and customize a plan, no matter your age, okay? Very, very important. Let's talk about myth 4. Sculptra results are permanent. Sculptra results are permanent or irreversible. This is not quite true. Sculptra's effects last up to 2 years, but they're not forever. The PLLA microparticles break down over time, and the collagen your body builds naturally degrades as part of aging. Again, that's why we need revolumization. We lose 1% of our collagen for every year of life after the age of 25. So we're in the situation that we need Sculptra to stimulate our collagen because we've already lost collagen. So it's not a permanent fix, okay? A 2014 study in plastic and reconstructive surgery confirms this. Sculptra's effects fade gradually with no permanent issue or tissue changes. Unlike hyaluronic acid fillers, it cannot be dissolved. There's a product called Hylenex, that'll be another episode, and we can dissolve those HA fillers. But this doesn't need to be dissolved because, again, your body, it's going to naturally just go away. It's important because you need to know the commitment. Again, a credible injector, you're going to hear me say this a lot, is going to explain what maintenance sessions means. That's every 1 to 2 years it might be needed to keep that glow. So ask your injector and provider, how often will I need those touch-ups? That way you're clear about your long-term plan. Okay, let's talk about myth number 5. Sculptra is painful with long downtime. Okay? Sculptra injections are painful and require major downtime. No, this is not correct. When done right with numbing agents, like lidocaine is already mixed in, reconstituted with the product, as well as we will topically numb our patients, it's pretty comfortable. Just like any other injectable or microneedling. Patients are back to normal within 24 to 48 hours, and though you may have some bruising or swelling, which is normal and can happen, here at Our Skin, I have a protocol for my patients. I prefer for you to be on arnica sublingually pre-treatment because it just helps to minimize the possibility of bruising and swelling. And if you do bruise, it is going to shorten the length time of those bruises. A 2016 study in clinical, cosmetic, and investigational dermatology found high patient satisfaction with comfort levels, and side effects typically resolve within a week. Your main job, again, is going to be that 5-5-5 massage that we mentioned earlier. It's not a huge disruption in your lifestyle. An experienced injector is going to use the techniques that they have learned in their training, and it will help to minimize discomfort and speed up recovery by using the arnica pre-treatment. You can ask your provider, what are you going to do to make me more comfortable? And their answer will tell you a lot about their skill. Okay, let's talk about the last and final myth. Myth 6, that anyone can inject Sculptra. Oh my goodness, ladies and gentlemen. Yeah, the aesthetics industry, it's like the wild, wild west, right? That myth 6. Sculptra can be injected by anyone with basic training. Sounds scary, right? So this would be a big no. Sculptra does require advanced skills because of its unique reconstitution. You need to understand the injection depth and the collagen stimulating action. Improper technique can lead to uneven results or complications. Galderma, the maker of Sculptra, mandates specific training, and studies like one from the Journal of Drugs and Dermatology in 2018 stress the importance of expertise. So again, researcher, provider, ask those really super important questions. Are they qualified? What credentials do they have? You can go through LARA or professional boards to make sure that they are legit. Ask your injector how many Sculptra treatments they have performed. You can ask to see before and after photos. Anyone in my treatment room can ask. I have some on our social media as well as our website too. Okay, so why does all of this matter for you, the patient? Because that's why I'm here. It's about you as a patient and your ultimate goal. You should care about these myths, whether you're considering Sculptra for your face, or I do a lot of body work, the buttock enhancement, elbows, knees, décolleté, neck, hands. Those are all really important, and understanding the truth will help you to ask those good, right questions for your peace of mind. So I'm here in Birmingham. I am CANS, which is Certified Aesthetic Nurse Specialist. It's an additional certification that I went through, and I'm always up to date with Galderma and their trainings on Sculptra. So let's reiterate again. How many Sculptra treatments have you performed if you're a patient and you're asking the provider? What's your treatment plan and timeline for my specific goals? How do you minimize risks for nodules? And can you show me before and after photos? Knowledge, ladies and gentlemen, is power, and debunking these myths ensures that you're making informed choices for safe, effective results. Okay, that's a wrap on today's episode of Our Skin Admission. We've busted 6 major myths about Sculptra, from its gradual results to its safety and versatility. I hope that this empowers you, the patient, to have confident conversations with your injector and make choices that align with your aesthetic goals. If you loved this episode, please share it with a friend, leave us a review, and subscribe for more evidence-based insights into aesthetic medicine. Got a topic you want us to cover? You can drop it in the comments or on our social media pages, or you can send us a message. Until next time, keep glowing, keep learning, and stay admitted and committed to Our Skin Admission, because we are here for you.